Hi, good evening. My name is Monique Hill, and I wanted to welcome you to tonight's webinar. The topic today is Should I Freeze My Eggs? And it's hosted by Dr. Hudson of Texas Fertility Center. Dr. Hudson is out of New Braunfels in San Antonio, and Texas Fertility Center is based in Texas, obviously with the name. And you can find out more information about TFC by visiting txfertility.com. We do these webinars free of charge every month. It's the third Thursday of the month. Try to say that several times over again. Third Thursday of the month. The next webinar is going to be on August 19th, and it's your first fertility evaluation. And then in September, we'll be talking about IVF orientation. So you'll not want to miss those. I love these webinars. It's an amazing way for us to learn from different Texas Fertility Center doctors, various topics. So you get to meet some of the different doctors in their locations. And it's an opportunity to ask questions that you might want to know before you go in for a visit. You'll see on your screen, there's a place where you can ask questions on the top right-hand side. If you hit questions, you can submit those at any time. We'll be stopping halfway through, and then at the end to answer any of your questions. Please know that your information is confidential, so please don't worry about any of it being released to anybody. And then before I pass it over, I also wanted to make you aware of podcasts that are done by Dr. Hudson and a number of different doctors. It's called Fertility Docs Uncensored, and you can find those podcasts on any of the mainstream lines. So I know I happen to be a big fan of podcasts. I spend a lot of time in my car, and I just love what I'm able to learn from these different podcast seminars. So I encourage you to check those out. So now, without any further ado, I'd like to pass the mic and the camera to Dr. Hudson.
All right. Fantastic. Well, welcome everyone. I'm so glad you're able to join us and learn a little bit about egg freezing and fertility and why it might be a good idea. I really look forward to your questions, so please ask them. Like Monique mentioned, I'm a podcaster, so I'm used to having the conversation, not necessarily just talking all by myself. So I look forward to y'all's input and really trying to dive into the subject and give you a little bit more information than you may have had before. So we're going to start off with just a little bit about what are eggs, where do they come from, and why are we even having this conversation? So obviously, eggs are the reproductive material of women, and females are born actually with all the eggs we're ever going to get. So we can't get any new eggs. Guys get new sperm every 72 days. We were given everything kind of in one fell swoop. When we were in our mama's tummies and we were about 20 weeks, we had about probably between 3 to 6 million eggs. By the time we were born, we're down to 1 million. And by the time we went through puberty, down to about 300,000. It's amazing how quickly they go away. Women ovulate about 450 eggs in a lifetime. And the rest of the eggs undergo something called atresia, or programmed cell death. They just kind of disappear. The rate at which they disappear significantly increases in our upper 30s and early 40s. However, in some women, that timeline can be shifted, and it's really hard for us to predict that. Now, sometimes people come in and they're like, am I out of eggs? Well, the answer to that is probably no in most cases, because even if you, at the average age of menopause, which is 51, when people aren't having periods anymore, you still have about 1,000 eggs. But the problem is we need a lot of them. And as we age, because our eggs are actually a year older than us, because they've been around a little bit longer, as we get into our 30s and 40s, the eggs become more fragile. And the embryos, so that's what happens when egg and sperm come together, the embryos that form are more likely to be abnormal. So, and what we mean by that is mainly dealing with the chromosomes. So chromosomes are kind of our genetic material. It's what makes us us, and we should have a certain number of chromosomes. Well, in humans, when egg and sperm come together and one cell becomes 2, 2 becomes 4, 4 becomes 8, etc., mistakes happen. Mistakes happen a lot. So what we find out is that in 50% of the embryos that are created, in women in their 20s and early 30s, half of them are chromosomally abnormal. It's just the way humans are made. That percentage of abnormal significantly increases as we move up into those upper 30s and early 40s. And so that's, we're kind of fighting against time. And unfortunately, I think because of media and things like that, we kind of get this impression that the biological clock isn't real. And unfortunately it is. And we face that every day. And if you're, quite honestly, the fact that you're listening in this webinar is fantastic, because you're already thinking of, what can I do to perhaps freeze time? Because that's in fact what we're wanting to do. Now, if you decided, hey, I'm thinking about freezing my eggs, and you go to see a reproductive endocrinologist, fertility specialist, somebody like me, one of the first things we're probably going to do is want to test your ovaries to see how they're working. Are they acting age appropriately? Now, when we're looking at freezing eggs, ideally, we would like to freeze eggs in the women less than 35, because we know that it's going to take less eggs to result in a pregnancy. Now, it doesn't mean we can't freeze eggs in women who are 35 and up. It just means we may need to do more cycles, and we'll get to that in a little bit. So a little bit about how do we test your ovaries to check on quality and quantity. So when we look at ovarian reserve testing, we kind of have three main modalities nowadays. So one is called an antral follicle count. That's where your doctor will do an ultrasound and actually count the number of little follicles, which are the houses of the eggs, on your ovaries that they can see at a certain time. Now, your body decided 2 months ago which follicles were going to be visible this cycle. And those follicles, the houses of the eggs, either are going to make a big follicle eventually, and you would ovulate, or they're going to undergo that atresia, or programmed cell death. They're just going to kind of disappear. So what we're really doing is taking advantage of 1 month's recruitment. Okay, so we go and we can count the number of follicles. An average number of follicles, most doctors are going to consider 10 or greater, reassuring. Okay, if we're less than 10, we're more concerned, and that time is important. Rarely do we say, oh, you can't do it. But again, time is going to kind of ooch us on that way. When we're looking at quality, age trumps everything. Okay. But we do have some hormones called FSH, or follicle stimulating hormone. It's what your brain produces that talks to your ovaries, and estradiol, which is what your ovaries produce that talk back to your brain. And we can get some information on quality from that as well. So generally speaking, we like to see FSH levels less than 10. 10 to 18 are concerning. Greater than 18, we're really worried at that point about the viability of your eggs. Again, these are guidelines. There's going to be different, different tests that can be run. When we put all these things together, that's really where we kind of get more information. Now, we also can do a test called AMH, or anti-Mullerian hormone, and that is a test that is going to give us more information on quantity, kind of like the antral follicle count. Okay. And what this information is going to do is give us a good idea of how we can stimulate your ovaries in the best way to be able to get those eggs to be frozen. So we're going to talk a little bit about what the actual process is for freezing eggs. So first of all, you are going to go through a process where sometimes people are going to be on birth control pills beforehand. Sometimes people may do this with just with a period start. Sometimes we may do something called estrogen priming, where we give you some estrogen and some additional medication kind of leading up to things. So we'll go and we'll kind of get things prepared when everything's just right. You're going to stop those medications, and we're going to start medications called gonadotropins. Okay. In the United States, the top 3 gonadotropins are going to be gonal F, Menopur, and Follistim. And depending on your doctor, you may use one of those. You may use a combination of those medications. And these medications are injections. Don't worry, they are use a very, very tiny little needle, and they're subcutaneous just under the skin. And we teach you how to do those yourself. And you would generally do those injections for a period of about 10 to 12 days. Okay, so it's good to kind of wrap your head around that part. And then we will, while you're doing those injections, we are going to monitor you. We're going to monitor you with ultrasounds. Okay, and we're going to monitor you with blood work. And generally, those monitoring visits are going to be relatively quick, but they will happen every kind of 2 to 3 days as you go through your kind of 10 to 12 day stimulation. So as I mentioned, those follicles, those little fluid-filled sacs in your ovaries are going to grow. So at the beginning of your cycle, they're generally going to be somewhere between probably 3 to 7 or 8 millimeters a piece. And we're going to let them grow to be somewhere probably between 18 to 22 millimeters. Okay, so they're going to get bigger. And as they get bigger, there's little cells within them that produce estrogen. And we're going to be watching that with your blood tests, watching that go up. So we'll do that. And then we, when the follicles are at the right size, you'll get another medication that will help mature your eggs. Okay, because mature eggs are the ones that can actually best be frozen and used in the future. Okay, so we're going to do that. We're going to give you the medication that's going to help mature the eggs. And then generally somewhere between 35 to 36 hours later, you would go in for what we call your egg retrieval. Okay. So your egg retrieval will generally be at some sort of outpatient surgery center. We have one location in Austin. We have one location in San Antonio. It depends on where your doctors are based. And you will go in, have nothing to eat or drink after midnight, and they will give you a little IV, okay, to give you some fluids, and it's also going to give you medication. So the medication is a type of anesthesia. You'll meet with your anesthesiologist beforehand. They'll give you anesthesia, and generally with this type of anesthesia, it's pretty easy anesthesia. You're still breathing on your own, but you don't remember anything, you don't feel anything. And then we use an internal ultrasound to, and this time it has a little needle on it that will go from the vagina into the ovary, and we'll draw the fluid out of the follicles. And in that fluid are your eggs. At that point, we will give those eggs to the embryologists, and these are the people who work with eggs and sperm in the lab, and they will process the eggs. They'll kind of clean them up per se, and then they will freeze the mature eggs, okay? And the mature eggs are the ones that are eventually going to be able to take a sperm. So we're going to pause here before we get too much into the actual egg freezing a little bit, and kind of go over some of those questions. So Monique, do you want to give us some of the questions that we have?
I'd be happy to. All right. One question was, sorry, it takes a little while to come on. Do I need to remove my IUD before freezing eggs and doing the injections?
That is a great question. And you do not need to remove your IUD. We do egg freezing all the time, especially with egg donors who have IUDs in, even the ones that produce a little bit of the progesterone hormone, and it doesn't seem to affect the quality of eggs or the quantity of eggs that we get. We have quite a bit of experience with this, and so I think it's very safe to say you can keep that IUD in, so you don't have to worry about anything afterwards, and you don't have to worry about getting it put back in, and you can just focus on preserving your fertility.
All right. This may come up later, but somebody asked if freezing can harm the eggs in any way.
Good question. So there's good data to say that freezing the eggs does not harm them. Okay. There's There are studies looking at over 900 babies that were born from frozen eggs, and there doesn't seem to be any increased risk of things like birth defects or anything like that. Okay. And we know that there's been over 5,000 babies born from frozen eggs. So there's a decent amount of data out there. Now, I would like to say that it does take generally more frozen eggs to create a baby as compared to fresh eggs. So if you have friends who are going through IVF, the entire process where they're creating embryos, and they may not need quite as many eggs to result in a baby as compared to someone who's using frozen eggs. So as a general rule of thumb, if you are freezing your eggs and you are less than 35, having about 10 eggs is probably going to yield a baby. So if you're kind of trying to figure out, hey, I want to ideally have blank number of children, that's something to kind of keep in mind. The older you are, the more eggs we're going to want to cryopreserve to give you your family of the future.
Can that mean multiple retrievals then, like back-to-back egg retrievals?
So it can. So a lot of it depends on what your ovarian reserve testing shows us. Okay. So there's some people that may just need to do one egg retrieval. Okay. And also, like I said, it depends on how many kids you want to have. If you only want to have one kid and you do an egg retrieval and you get, 12 eggs, you're probably doing good. If you want to have 3 or 4 kids and you're really wanting to freeze eggs for all of those children, that's probably going to be a few retrievals. Now, you don't necessarily have to do them like seriously back to back. Most of my patients will take a few months off in between, kind of get life back in sync and doing things, and then we'll do another cycle. I have one patient right now that I'm working with, and we just completed her 3rd cycle, but it's because she's looking at kind of her big picture, and that's what she wanted. And, what I would say is freezing some eggs is better than not freezing anything also. So if finances are an issue when it comes to freezing eggs, that I would rather you have some frozen, and then we can use those in the future. Also knowing that our technology is advancing so much that what we need right now may not be quite what we need in the future if you're using your eggs maybe 10 years down the road.
This is a question I would ask. Is this a painful process, and how much pain should I expect?
That's a very, very good question.
And also, do people usually gain weight during the process?
Right. So you're doing something for about 2 weeks. So any weight gain that you may get, you should be able to get off relatively quickly. Okay. Now, how uncomfortable is this? I can say I went through IVF myself. So I do actually have firsthand knowledge, not just, the doctor telling the patient type of thing. So when you're going through your stimulation in those 10 to 12 days, probably the first 2/3 of it, you're going to feel very much normal. Okay. Towards the end, most people have some pressure, kind of bloating feeling. Your skinny jeans probably may not fit quite as well as they normally do. Because if you think about it, your ovaries are normally probably about this big. Okay. Our goal when we're doing the egg retrieval is for each of your follicles to be about that big. Okay. So you can imagine that if we're taking something maybe the size of a chicken egg, okay, the size of your ovary, and we're making it the size of an orange or grapefruit, depending on how many follicles you have, that's going to be a little uncomfortable, okay? So it doesn't hurt a lot. It's just kind of like, oh, this feels weird. Now, when you go through your egg retrieval, like I said, you have anesthesia, they give you pain medicines, and most people, you're going to be achy and crampy that day, but generally the next day, you're going to be better the day after that. I can say when I did my egg retrieval, hopped on a plane, flew across the country, and I was back at work the next day. Not everybody's going to be like that. The more follicles you have, the more achy and crampy you're going to be, but also probably the more eggs you're going to get. So there's a little trade-off in that. Okay. But most people do quite well with it.
And cover like from beginning to end, what's the amount of time that they can expect? I heard you say 2 weeks. Is that about it? Or is it longer?
The process itself is about 2 weeks for the stimulation and the retrieval, everything said and done. Now, from the time you see your doctor to egg retrieval, that's going to vary some, okay? Because it's generally going to be, we're going to want to do some testing and kind of work with your schedule and those types of things.
Okay. How successful is egg freezing? And you also mentioned that there have been 5,000 births to frozen eggs total. Is that in the U.S., in Texas, and how does fertility, Texas Fertility Center compare to those statistics? Was that too many questions at once?
I think I can wrap them up together. So yes. How successful is egg freezing? So I'm going to say a lot of this depends on kind of like real estate, location. And what I mean by that is not all labs are created equal, okay? And not everybody is as good as everybody else in freezing eggs. I can say at Texas Fertility Center, we're really good at doing it because we've been doing it for quite a while, okay? We have worked with egg banks like Fairfax Egg Bank in the past, and we've been producing eggs for egg banks for a number of years. And so we have a lot of babies born and that 5,000 is worldwide. Okay, but also realize that people who are freezing their eggs, they're not necessarily using them right now. Okay, so they're freezing their eggs to use in the future. And egg freezing until about 10 years ago was considered experimental. And what changed that was we figured out a different way to freeze the eggs. So previously, the egg is the biggest cell in the body. And part of the reason it's the biggest cell is it has a lot of water in it. So the way we used to try to freeze eggs, it was a slow freezing process. And essentially ice crystals would form within the egg, which obviously when you kind of visualize that, doesn't sound like such a great idea. And what was developed was a process that's now called vitrification. And the easiest way to kind of visualize vitrification is the egg essentially kind of gets dehydrated and quick frozen. And so there's no freezer burn on those eggs. And so the nice thing is it doesn't matter how long they're frozen. So whether they're frozen for or cryopreserved for 1 day or for 10 years, those eggs are frozen in time. Okay. So if you are 28 right now and you freeze your eggs and you decide you are not going to have a baby until you're 38 or 45, those are 28-year young eggs, no matter how old you are. Okay. And so literally we're able to freeze time. Did I answer all of those questions that you asked?
I think you did. That was very good. Thank you. And you answered another one, which was how long can eggs stay frozen? Is there a max number of years? So that's amazing.
Good deal. Well, how about I talk about what happens to these eggs after we freeze them and what happens down the road. So immediately after they're cryopreserved, those eggs are generally sent to a long-term storage facility. So there are certain places that store reproductive materials, so like sperm and eggs and embryos, for long periods of time. Usually eggs and embryos and sperm are not stored at your clinic nowadays for a long period of time. They are shipped to these long-term storage facilities, and then they stay there. Storage facilities are going to charge you an annual fee. It's usually somewhere, I would say, probably between $300 to $600 per year. It's going to depend on which facility you use, and they are there being monitored, atmospheric control, making sure everything's just as it should be until you're ready to use them. So at the point that you're like, hey, I'm thinking about wanting to get pregnant. So at that point, you have some choices. And some of that, I would encourage you to talk to your reproductive endocrinologist, fertility doctor, because sometimes we may say, hey, let's try using your eggs now, just trying to get pregnant the old-fashioned way, or even if you need a little bit of help, and then go to using your eggs if you absolutely have to. Some people are like, I froze those eggs. I want that decreased risk of miscarriage. I want the decreased risk of birth defects. I want the higher chances of pregnancy that come with those eggs that I froze years ago. And that is perfectly fine. So what we would do in that scenario is we would have your eggs shipped from long-term storage back to the embryology lab, and then the eggs are warmed. Okay. And then they are going to be inseminated with sperm, either partner sperm or donor sperm, whichever is for your particular situation. The way that the eggs are inseminated is with a process called ICSI, where we inject the best looking sperm into each egg, and then we let them fertilize. And then we usually let the embryos grow out to the day 5, 6, or 7 stage. Now, at this point, you have some choices. Some people would choose to transfer those embryos, and generally those embryos would be transferred 1 or 2 at a time, generally at the most, into your uterus that has been prepared with some estrogen and progesterone medications to make it a very hospitable place to accept a little embryo. Okay. Now, nowadays, quite a few of our patients are taking advantage of something called PGT, or pre-implantation genetic testing, specifically for what we call aneuploidy, or abnormal number of chromosomes. So remember, I talked earlier about that half of the embryos we create, even when we're in our 20s, are chromosomally abnormal. So if we're able to test those embryos, which we can at that day 5, 6, or 7 stage, where we can tell what part of the embryo is going to become the baby and what part's going to become the placenta. We can sample a few of the cells that are going to become the placenta, cryopreserve the embryo, send those cells off to a lab to find out which of the embryos are chromosomally normal, and then we can specifically transfer that one embryo into a woman's uterus, giving you much better chances of pregnancy and less risk of things like miscarriage. So those are kind of the things that we can think about when we're looking at what do we do with our eggs eventually, and it's a relatively easy process when you're ready to do that. You just have to kind of get back in your doctor's office, and they come up with a plan, and within a month or 2, we're generally ready to have embryos and ready to help you achieve the pregnancy that you've been dreaming of. All right, so why don't we hit some more questions?
Okay. There are some questions on IVF and egg freezing, if there's a difference between the two. And one question specifically is, do we have to do IVF to use our eggs, or is there a less difficult, intense way to use them? Maybe you can clarify.
Yes, I can clarify. So IVF stands for in vitro fertilization. So egg freezing is what would normally happen in an IVF cycle is all the things I talked about, the stimulation, the retrieval, okay? And normally after retrieval is when we do that fertilization. So that's that in vitro fertilization. So we're doing that first section of the IVF process, taking a break for however long you want, and then completing it at another time. So egg freezing is a part of IVF, but we're taking a break halfway through. Okay. And so is IVF the only way for us to utilize your eggs? Yes, because we have to have a way to get your eggs, and then with the ICSI, where we inject the sperm, is how the eggs can achieve fertilization. Because when the eggs are frozen, the outer kind of shell is not quite as receptive. So we can't generally do standard insemination where we just put eggs and sperm in a dish. We could, but we would expect significantly decreased fertilization rates. So we kind of help things along a little bit.
One person asked if there's an age that you'd suggest using the eggs by. This person's 39 and curious how long she has to freeze, to still use her eggs once they're frozen.
Good question. So our guidelines at Texas Fertility Center is all embryo transfers have to be completed by your 56th birthday. So you got some time. Okay. Now, with that being said, the older you get, the higher risk pregnancy it can be for you. Okay. So when we're talking about women who are in their late 30s, 40s, early 50s getting pregnant, there are increased risks of things like diabetes in pregnancy, blood pressure issues in pregnancy like preeclampsia, increased risk of C-section, complications of those types of things.
Yes, there's also a question with regards to egg donation versus egg freezing. I know kind of blurs a line. Some also, I think, with regards to egg freezing, and if somebody decides not to use them, could they donate them later?
Good question. So the process of egg freezing is often used in egg donation. Okay. They are, when you're setting out to do those things, though, you really need to be intentional on, am I wanting to be an egg donor right now, or am I wanting to freeze my eggs for me right now? Can you donate them in the future? If there was somebody you knew, there is the potential that you could do a directed donation specifically to somebody. Because egg donors have to go through, anonymous egg donors have to go through a pretty rigorous screening process. Kind of donating your eggs for somebody to use in an anonymous sense is logistically pretty difficult. We're regulated by the FDA, the Food and Drug Administration, and we have to follow all the same rules for egg donation as they do for any type of organ donation. So like heart donation, lung donation, liver donations, all those types of things, they're all under the same umbrella. And so there's very specific things that have to happen. And in most cases, those things haven't happened in what we'd call an autologous, or I'm doing it my own eggs for me to freeze for myself. So there's some process issues, but if I have had a patient in the past that knew somebody who she wanted to give her eggs to her, and because they knew each other and it wasn't anonymous, that could happen. So, but that's a little bit of a rare circumstance.
Somebody asked, how long is one cycle of freezing?
So essentially a menstrual cycle. Okay, so you kind of at the think of the beginning of your menstrual cycle as the beginning of your stimulation. You go through your stimulation, which is 10 to 12 days. 2 days after you're ready, you're going to have your egg retrieval, and then you're done. And you are generally going to start your period about a week later. So the entire thing is about 3 weeks, okay? But the part that you're really focusing on is that 2 weeks time segment.
And what if they have an IUD and don't have a period later? Any concerns or things to consider with that?
There's no concerns with that. We know that lots of those IUDs, especially the Mirena and the Skyla, you don't get a normal period. Some people are going to still have a bit of a period just because we've stimulated your lining enough that you've had more estrogen in your body than what you did on kind of your normal menstrual cycle. And with your normal menstrual cycle, your estrogen level goes up a little bit, but your progesterone secreting IUD keeps your lining nice and thin. It still tends to do that with the egg stimulation, but your estrogen levels naturally would probably be around 200. And sometimes we have estrogen level in the thousands. So a little more stimulating to the uterus.
All right, this one might be hard to answer. You mentioned 10 eggs would be smart for a younger person. How many rounds or eggs would you suggest for a 40-year-old?
So I can't necessarily answer the rounds because I've had a 40-year-old produce, 20 eggs before. I've also had a 40-year-old produce 5 eggs before. So that I can't really say. And again, it comes down to how many children you want to have. So if you're 40 and you're like, I just really want to have one child, I would say probably 15 would be a good number to make you feel relatively good that it would help ensure your situation. So it's a hard thing to answer without having all the specifics of an individual. And this is where we really kind of individualize each person's care.
And I know for this, cost is a huge consideration for a lot of people, and it's probably hard to know from one person to the next what the cost will be. So what's a good way for them to get some idea of that? And then also, does insurance cover any of the procedures?
Good question. I actually asked my staff this morning, so I would have somewhat of an answer on that for you. So at Texas Fertility Center, a round of egg freezing, excluding your medications, is going to be about $7,000. Okay. Medications are going to vary somewhere probably between $3,000 to $6,000, depending on how your ovaries are acting. Does your insurance cover it? That is going to depend on your employer and what your employer's coverage delineates. And so what I can tell you in Texas is that most insurances are going to cover diagnostics. So all that testing stuff I talked about earlier, that is usually going to be covered by your insurance. When it comes to egg freezing, that is going to be probably, depending on which part of Texas you're in, somewhere between 25 to 50% are going to have some coverage. The best thing you can do is actually contact your HR representative and ask them what type of fertility treatment coverage do they have and if egg freezing is available. It's becoming more and more common. But you have to, like I said, it just depends on your employer. Now, things to know, though, is there are usually financing options that you can talk to at your respective clinics. We have access to give you information about some different companies that specifically work with people who need money for fertility reasons. Most people don't, you don't sit there and, you may save up for a car, but you're not necessarily saving up for freezing my eggs. That's not something most people are thinking about. And so there are special financing options that we can point you towards once you become a patient.
Yes, that's so true. That's amazing that there are companies out there that do that now.
It is.
One question is ovarian reserve and age of menopause genetic?
Good question. So maybe. So, if you come in to see me and you tell me my mom went through non-surgical menopause, so that's an important thing. If your mom stopped having periods because she had surgery, it doesn't count. Okay. So, but if she naturally went through menopause and she was 35, 40 years old, that's going to make me a little more concerned. Okay. And you are definitely somebody who should probably come in and have ovarian reserve testing done sooner than later. There are some genetic conditions that can decrease your ovarian reserve faster and make it harder for you to get pregnant. And so it's something to pay attention to when I talk to patients and I get that part of my history, because one of my questions is, anybody have early menopause? If I hear that, my little spidey sense is like, ooh, we may need to be a little bit more aggressive than less aggressive. But it's not always the case. But if you do have a family history of somebody, sister or mom, that went through early menopause naturally, and it's good to find out, one, like I said, make sure it was natural, what age that was, and talk to your doctor, because that way we can kind of get some testing done earlier and see if maybe your clock may be ticking a little faster than somebody else.
Good question. That's all I've got. I don't know if you have any more information you want to share, or if you want to end it at this point.
Well, the last thing I want to share is that, first of all, I am so proud of all of our people coming in listening today, because this is a huge first step. I think of all these women out there who were we're focusing on careers and education and getting this done and getting that done. And, it's important and it's reality that our biological clock is real. And so, my hat's off to each of you for at least thinking about it. This may be the right option for you. It may not be the right option for you. There's lots of people that I talk to that they're like, I think I'm okay. But then there's other people who are like, I really don't want to leave that up to fate. And so if you don't want to leave it up to, just, the whims of the future, there is something you can do, something you can take control of. And we're happy to help you in any way, shape, or form. All right. Well, thank you, everybody. It's been a pleasure. I look forward to seeing you at our next one.
Thank you so much, Dr. Hudson. That was amazing. Thank you.
My pleasure. My pleasure.